Welcome back. For those of you just tuning in, I am Rachel Ash. I'm here with Juhi Singh and our very special guest today, Dr. Suzanne Steinbaum. Today's show, we've been talking about heart health, specifically women's heart health, and Suzanne's practice now at the Juhi Ash Center. So welcome back, ladies.
Thank you.
Thank you.
Thank you. One of the other things we were talking about, getting to the root cause of symptoms, treating people on an individual basis, and basically how the two of you are really changing the face of healthcare and changing the face of how people should be treated. And when it comes to, you know, their biochemistry, their internal terrain, what's going on in your body, and really just how the healthcare system's been failing you. And the way that you guys are practicing now is really just creating something incredible experience for your patients, and just really amazing in terms of shifting a paradigm in what healthcare should be. And with that, one of the topics that we hear about a lot, and I know, Juhi, you and I talk a lot about it, is inflammation. It's a root cause of a lot of disease, a lot of illness, and I would love for you both to talk about it, Suzanne, how it how it pertains to heart health, and then Juhi too within your practice.
Absolutely.
Many years ago, I was giving a talk on behalf of Go Red for Women through the American Heart Association. This was an interesting talk. I was really talking about the connection between the mind and the heart. And that when we get caught up in our minds and we get caught up in our lives, sometimes that stress response leads to an increase in stress hormones, epinephrine, norepinephrine, and cortisol. And what happens is there's an increase in inflammation in the body. And when there's inflammation, it leads to plaque in the arteries. And when that happens, you get atherosclerosis, and then you get heart disease. So that stress is a root cause of heart disease based on this whole process. Well, I went through this whole thing, and all the women in the audience, I would say, do you know what I mean? And everyone's head nodded yes. And it was this validation to them that what they're feeling is real. I got back to my office and I got a call from the National Center of the American Heart Association. This was a little while ago. And they said, "Doctor," I was like, oh boy, what did I do? Stress is not considered a risk factor for heart disease. I was like, listen to me. There were 500 women in that audience, and I'm telling you right now, they all know it's a risk factor for heart disease.
And the world is flat.
And yeah. And, you know, it took a while, and they really were concerned until it became validated. Well, now I say stress is a risk factor for heart disease, and everyone's like, yay, it is. You know, now it's okay. But it took a minute for the mainstream research to get to the platform of saying stress is a risk factor for heart disease. So why does it matter? And we talk about this inflammation piece, which became a really hot topic maybe 5 to 10 years ago, although I lose track of time. It could have been longer and or shorter. I don't even know. And I think that what we've all understood is that stress leading to this inflammation and this inflammatory process, which leads to heart disease, cancer. I mean, it's really an underlying mechanism.
Chronic illness.
Chronic
Autoimmune
illness.
disorders.
Yeah.
Name it.
I mean, you name it. This is what's the driving force behind so many disease processes. And so how do we deal with inflammation? But more than that, how do we know if there's inflammation? And if we're looking for objective data, well, guess what? There's now blood tests that can tell us about really subtle inflammation. There are now blood tests that can tell me about proteins that are in the bloodstream that are associated with inflammatory markers that lead to heart disease. This is from the endothelium, which is the lining of the artery. And that endothelium is the first thing that becomes damaged. If you don't have damage to the endothelium, you don't get heart disease. So if you get to assess the endothelial health through inflammatory markers and proteins that you can pick up from a super subtle blood test, wouldn't you want to know?
Absolutely.
Yes.
Well, guess what? We're doing that. And we can look at these blood tests and we can say, you need to actually do X, Y, and Z. It's not just a marker without having an outcome or an intervention that can change things. We can do these tests and then really tell you what you need to do for heart health. I truly believe that no one needs to get heart disease. What we know through the guidelines, what we know through research, 80% of the time, heart disease is preventable. That's by preventing the major risk factors: high blood pressure, high cholesterol, elevated sugars, stress, I get to say that out loud, family history, smoking, and really a poor diet. And so how do we control all these things? Well, we can, and we can not only control them, we can know if any of these have had any effect on the lining of your arteries. We can make intervention. And as far as I'm concerned, that would mean 100% of the time, nobody needs to get sick from heart disease.
Amazing. And one of the things that we always love to say at the Juhi Ash Center is we ask, which is the most important instrument in a symphony? And the answer is they all are. Otherwise, you wouldn't have the symphony. And that's the way that, Suzanne, you evaluate your patients. I know, Juhi, that's the way you evaluate your patients. And it's really, you're doing somebody a disservice if you're not looking at all of those factors.
Absolutely.
I mean, you can't ever get an accurate read on somebody if you don't have all that information.
You know, one of the most compelling things that happened recently in the guidelines was the women and heart disease guidelines through the American Heart Association, which it showed that women who have preeclampsia or elevated blood pressures, gestational diabetes, or elevated sugars during pregnancy have an increased risk of heart disease later in life. Within 10 years, those with gestational diabetes are most likely to have diabetes and high blood pressure. And so all of a sudden, this is not that long ago, we put together this picture that a woman is a whole person and who she is throughout her life matters. You know, when I read this, I was like, oh my goodness, I lived on jelly bean and coffee for like 5 years. I'm going down. You know, we all have, but we are one person and we live this life in this one body. So how we've lived that life and what has happened to us throughout it makes a difference.
Absolutely. And it's not just physically what happens to us, but it's mind, body, emotion, spirit. And Juhi, at the center, all of these things are addressed as to what makes somebody whole.
Absolutely. We look at every facet. Because we do such extensive blood work and testing, we're not just looking at the symptoms that a person presents with. You know, I'm looking at how are they sleeping. You know, as I mentioned before, what are they eating? What is their daily routine like? We really have to get down to the nitty gritty and understand from a very fundamental level what is happening in the body. Because if you don't understand that, I don't believe that you're ever fully healing a person. And I can speak, I think, for Suzanne and myself to know that both of us practice wholly from our hearts. This is not just our job. This is we chose this career path because we didn't want to see people suffer. And we practice very similarly in that we give every patient the time to talk and express what they're feeling and not feel like they're being rushed out of a room, but to understand who they are and what's important to them and what makes them happy and what stresses them out. You know, these are all factors that I are often overlooked and have a phenomenal impact in the way that your body functions. And so, again, addressing with acupuncture, Chinese medicine, and Ayurvedic medicine, when we look at inflammation, we know that this is the first step in disease. And so we're trying to not just decrease the inflammation. Oftentimes, as Dr. Ash taught me, vitamin C and quercetin, very powerful combination with Pure Essentials. That's, as you said, 1 + 1 equals...
That's a 1 + 1 = 10. The Pure Essentials, vitamin C and quercetin. Right?
Combination. But again, you know, just getting down to the nitty gritty, understanding what people are eating, understanding what their constitution is. You know, from my perspective, what is good for one person may not be good for another person. I don't care if it's spinach or kale, or if it's an avocado. We really have to get down to understanding who the person is, what affects them, and what their bodies need, what they're deficient in, and replenishing that source.
Juhi, you said something earlier that I think is really interesting conceptually.
Tell me.
You mentioned that we all hold things in our cells.
Mm-hmm.
And I really think that concept is so interesting There's so much research out there about PTSD.
Absolutely.
There's so much research out there
The cellular memory.
about childhood trauma and how it impacts health later in life and has an increase in chronic disease. And you sit here and maybe you think to yourself, why? And I'm going to tell you the why comes down to, just like you said, Rachel, it's this incredible cellular memory.
Mm-hmm.
And the cells don't talk, but they really do.
But they remember everything.
And if you can really figure out what's going on that cellular level, that's the answer.
Absolutely. I always say thought manifests on a cellular level. Oftentimes, we just ignore it because we're so busy getting through the day that we're not paying attention to what our bodies are often telling us. You know, if you're dehydrated and you're thirsty, that means that there's something wrong. It means that, you know, you need liquids. You need hydration. If you haven't gone to the bathroom for, I don't know how many days, it's indicating that there is something wrong in the system. But oftentimes we're in such a rush in this fast-paced society that we don't ever stop to look to say what is it that's causing it, as opposed to just medicating it. If someone gets a headache, why did you get the headache? I don't want to just take the symptom away. I want to understand why it happened in the first place. If you're suffering from migraines, why? If you're having anxiety attacks, why? You know, it's really getting down to the why, so that it does not occur again. That's what our goal is that, you know, we want to understand at a very grassroots level how to prevent disease from happening. As most of, if you're familiar with my story, I was diagnosed with ulcerative colitis and Crohn's disease at the age of 16 and was in remission for over 20 years until last year. And what healed me the first go around, after 3 years of extensive Western medicine and protocols, treatment, I'd done everything. And as a last resort, my mother had called my aunt in India, who's a doctor in what I do. And my aunt said, stop everything, send her to me, because I was one step away from a colostomy. And after 2.5 months of having acupuncture and being placed on an Ayurvedic diet, which is a diet for my constitution specifically, I was symptom-free for 20 plus years. And then last year, I had another flare. And I realized that we've created the center that I needed for myself, where we've got the best practitioners under one roof. And so you're not jumping from doctor to doctor. You're jumping from maybe one room to another, but we're all working together. You know, it's coming down to see a nutritionist, Suzanne, myself, whatever, or a physical therapist, whatever you need, we're all there together, and we're all working together to create the best possible outcome. But getting back to the colitis, I know that if I would get nervous, when I say thought manifests on cellular level, that anxiety immediately would go to my stomach. And that anxiety or stress for everybody is different. Some people get migraines, some people it manifests in their muscles, some people it goes to their heart. We need to understand, where is this going? And that's why it's so vital to really know the body and know how your thoughts and what you're eating and your exercise, how that's impacting. And having Suzanne as part of the team, this is the best gift I think we can give to our patients.
And I would say your patients are so happy, not just because I'm a patient of both of yours, but but you get incredible results with your patients. You know, I've known both of you for years, and I know your patients. I know a handful of each of your patients, and I know they rave. And I know they rave because they've gotten better and they've gotten results. And something that you both brought up is about masking symptoms. I think doctors are taught really well how to medicate. They're taught really well how to give a pill and get something to go away. But what you two do is different. I mean, medication where necessary, but you listen and you teach people how to listen. And that if somebody has a symptom, it's your body sending a message. And what does that mean? And you're detectives in a sense as to getting to the root cause of what's going on. Let's not mask it. Let's help it. And you really get incredible results. And that's why the two of you together, it's just like, oh my God, we're
very
thrilled.
powerful combination. You know, what I
You're a
always
power
visualize,
couple.
yeah, we are. What I always visualize is a puzzle, and that puzzle is not put together yet. And so when the two of us get together, we're able to piece that puzzle together from two very different perspectives, but come together and figure out what is in the best interest of the patient. Again, looking at it from the Eastern perspective and the Western. So you've got, you know, two specialists. I can definitely brag about Suzanne, that if anything, I've sent my family to her. And again, at the ASH Center, we have hand selected the doctors that I would only send my family and my closest friends to. And I want that to be accessible to everybody.
Yeah, it's a real amazing trusted network. And on that note, we have to cut to our next commercial break. But for more information on Juhi, on Dr. Suzanne Steinbaum, on the Juhi Ash Center, you can go online at www.juhiashcenter.com. That's JUHIASH center.com. And also, Juhi, you mentioned Pure Essential Vitamins before. There's information on Pure Essentials on the website, or you can call the office at 212-758-3200. That's 212-758-3200. We're located at 800A Fifth Avenue in New York. That's at 61st Street, overlooking beautiful Central Park. Call us, come visit us, and we'll be right back right after this.